So peripheral neuropathy has many different causes, and I think the very first thing that I do when I sit with somebody who has peripheral neuropathy, which is just broadly numbness and tingling or pain of the hands and the feet, that often progresses from fingertip up through the arm in a glove-like distribution, or from the feet up the legs. Although there are more nerve pathway patterns that can happen as well. But the point is that we want to figure out why. So the most common causes of peripheral neuropathy are diabetes or drug-induced peripheral neuropathy. I see a lot of that in my cancer patients. And so it's important to know the why, because that guides the how to manage. If a person has a drug-induced peripheral neuropathy, it's often because there's a induced deficiency or a direct attack of the medication on the nerves. And so if there's an induced deficiency, obviously it's going to be very important to replete that nutrient. A classic example of that is the platinum chemotherapies and magnesium. The platinums actually chelate out magnesium, and then a person ends up with this magnesium deficient neuropathy. With the diabetes, of course, that's more a blood flow issue. So the diabetes has created a lot of inflammation and restriction of flow of the little blood vessels that are in the fingertips and the toes. And with that lack of blood flow, the nerves are being damaged. And so yes, we want to help try to repair the nerves, but we've got to get the blood flow going. And so you can see there's very different treatment approaches depending on the type of peripheral neuropathy. Just to throw in a wrench, there's also the idiopathic peripheral neuropathy, which literally means we don't know why you have it, but it's happening. And so when a person has something like an idiopathic peripheral neuropathy, there's a very, very thorough history that needs to be taken so that I can try to assess which of these sort of most common causes of the neuropathy are likely at the source for this individual person. So do they have other signs of impaired blood flow? Do they have other signs of deficiency? Again, what's at the heart of their neuropathy? Because it's never ever normal for your nerves to not function. There's always a cause.